Cancer specialists say it could take more than a decade to clear cancer treatment backlog in the country. The third Uganda Conference on Cancer and Palliative Care in the country that was held at UBC Auditorium and by Zoom attracted experts on cancer. The chairperson, Dr. Charles Ayume, Parliamentary Committee on Health, advocated for integrated multi-sectoral approach on palliative care and asked for its insertion in the medical school's training curriculum.
As a policy, we try and push for the policy on palliative care. There's an interlink between the patient's rights to health care and also the policy on palliative care. So this policy, pushing for this policy comes at a time when the Parliamentary Committee on Health is also chasing other policies, including the National Health Insurance Scheme. How does palliative care fit into the scheme?
The Executive Director, African Palliative Care Association, Dr. Emmanuel Ruyirika, asked for an increase of investments and ring-fence funding for cancer and palliative care when it also comes to pandemics.
In Africa, many of the governments in Africa, when they were hit by the crisis, they moved resources away from most of the other things. We've just heard the Honorable talk about cuts. And the money left cancer and left HIV and some of the other non-communicable diseases and went to COVID-19. In addition, the lockdowns disrupted access to medicines, again in most of those countries.
The head of childhood cancer at the Cancer Institute, Dr. Joyce Balagade, said that childhood cancer care in Africa, particularly in Uganda, has been hit hard by COVID-19 pandemic.
Despite COVID, childhood cancer is not going to wait. It will not wait for all of us to get on top of the COVID pandemic. It is incumbent upon us to make sure that we continue to do everything it takes, COVID notwithstanding, to make sure that our children get the best care possible, to make sure that we're treating them.
As the country is grappling with less oncologists, there is need to train more in that field for better management of cancer and palliative care in the country.
Funding for oncology centers. If the Cancer Institute is to sustain training of all these specialists, we need funding in our training programs, in our cancer research programs, but also in care to be able to provide a state-of-the-art service to our patients.
Zahara Abigaba, UBC News.